Hello everyone. I'm going to talk to you today about the gender and diversity evaluation tool that we've developed at Coventry called EAASI. So there's a bit of a dilemma with design and evaluation when it comes to taking gender and diversity into account. Designers and service providers need to ensure that transport-related products support a diversity of users, but there are very many different types of products that we're looking at and evaluating. So we've tried to provide some guidance on taking gender and diversity into account, and we're hoping that we can assist empathy so that we can help designers to achieve some empathy, to get a little bit better empathy through using our tool. And we're hoping we can assist, that this tool will assist them in understanding the gaps in between their design and where they would really like to be in terms of something that has good gender and diversity appeal. So within TInnGO, we have 5 criteria that have been proposed: effective, attractive, affordable, sustainable, and inclusive. And these go well beyond simple usability. So you can't really just use a usability checklist to evaluate, to get at these criteria. So we developed the checklist for evaluating products against the TInnGO indicators. And we've refined this checklist against some existing products and against some of the ideas in the Open Innovation Platform. So we've improved it as we've gone along. We think it can be used to develop a brief. It could be used as a design tool to improve designer empathy, and it could be used to evaluate products for procurement and to evaluate or compare competing products. So what are its key features? I'll just briefly put them together on this slide. The EAASI checklist prompts the design, begins by asking the designer to clarify their design brief goals and to think about how they've addressed diversity in their design process. So in part A, we have a declaration stage where people can describe briefly the product that they're evaluating, say what its goals are, and append any design briefs and images that they want to. Now in part B, this is where the sort of TInnGO evaluation magic bit goes. We've provided a number of relevant questions to ask for evaluating a product for gender smart mobility. So in step 1, there's some goal definitions. So you define what each indicator means for that product. In step 2, you evaluate it against those goals. In step 3, you consider the different groups of users and ask in step 4 who might be excluded from using the product. And then there's an opportunity to give a percentage score, which helps you in really comparing against other products and giving you an overall idea of how you rated it. And finally, there's an overall assessment for each indicator where we bring everything together. So I'm just going to show you very briefly what the checklist looks like. On the left, in the left column, these are the things that you have to do. And in the right column, you type your answers. We're providing a worked example so people can get the worked example and copy it. We're also providing a blank sheet so they can start with a blank sheet. So, for example, this is just part A, where you describe the specifics of the product, the name of the product, you define the goals for the users, for the providers. So you set out what you think your goals are. You provide the design brief, you specify what part of the product you're evaluating. If I continue with part A, here we're asking them to think about what their design process was. Did they consult diverse groups of users? Was any co-creation or user involvement used? And this is quite important because it may not have occurred to to designers that they should perhaps have thought a little bit more carefully about the groups of people they've been designing for, maybe go and talk to some of them. It's an important stage. It's important to know, if you're evaluating, whether anyone was consulted in the design phase. We asked them to set out the primary and secondary user groups, to decide what the task context is, and we talk about ask them to consider the street environment, the time of day, lighting, weather, and so on. So this is all prompting people to look a little bit further than just the product, to look at the environment and the task and the user needs. In part B, this is where we consider each indicator. So this one is for the first indicator, which is effective. So we provided a definition of the indicator. So effective means, does it deliver what it promises? Does it produce the intended result from the perspective of both the user and the provider? And we put some more detailed definition in here so that people know what we mean by effectiveness. And we've done this for each indicator. So here we go. You define some goals. How would this product be effective for end users? So in this example, it's an e-scooter, and we say it should be measured in terms of how well it enables people to move speedily and safely around the city without overly impacting the safety and convenience of others. It shouldn't impinge on others' enjoyment or safety in the city. And that continues. There's another stage that we have included in this checklist, and that's about intersectionality. It's a key focus in the checklist. You'll have seen this Timmy wheel before in some of the other presentations. It's another tool that is developed, that has been developed, and that could even be used in companion with this. But in EASI, each section in the tool repeats a list of groups that have intersectional characteristics. So in doing that, it keeps prompts evaluators to keep intersectionality in mind throughout the evaluation. So here's the intersectionality part of the checklist, and we do this for each indicator. So this is the one for effectiveness. Consider the needs and intersections where relevant. So here's a list of groups that have intersectional needs. Now it's not an exhaustive list, but we feel it's a pretty good list, that it covers quite a few different groups that people might not necessarily think about. So it covers women, covers work commuters, it covers leisure travellers, people making chain trips, adults travelling with children, low income groups, young people, older people are there, people with disabilities of various kinds, remote locations, minority ethnic groups, and people feeling vulnerable. And also the transport providers are another group. And this checklist means people have to think, well, how effective would my product be for that particular group? So thinking about women in general, well, the use may be dependent on what they're wearing and their clothing. For people making chain trips, well, a scooter won't be effective. So it begins to flush out some of these different ratings, and you give a score percentage as to how effective you think it is. This checklist repeats the list for each indicator. Overall, there's a final evaluation for each indicator. So for effectiveness, we finish up by saying, who's it effective for? And is it effective for the citizens it was aimed at? And then we say, well, who's it not effective for? And this is where we find out who's been excluded by this particular design. So for example, for the e-scooter, we find that although it's very effective for the able-bodied commuters and tourists, it perhaps impacts on pedestrians, and it may not be very effective for female use. They may not want to use it for all sorts of reasons. People with physical cognitive disabilities will also be excluded. So again, we carry forward that percentage score and give our overall impression. And this is just to show that we do this for every indicator. Here's the one for affordable. So again, at the end of going through all the different groups, we say, who's it affordable for and who's it not affordable for? So again, we give a score. And we've included a smiley rating just because it's a more visual way of giving an approval than a number. Finally, you get to the end of the checklist and you create a summary page carrying forward everything you've done. So you ask, did the design meet its own goals? So for example, in the case of the e-scooter, yeah, it did pretty much meet its own design goals, the design brief. And then we ask, well, did it meet the gender and diversity SMART goals? And in this case, the e-scooters didn't score very well on the EASI gender and diversity SMART goals. And we carry forward the percentages, and we can add notes as to why it didn't score, or maybe if it had scored well, we'd say where it scored better. So that gives you your overall view, and then you can finally, we give a few next steps guidance to say, well, we hope we've given you some insight. What are you going to do now? Designers, you might want to revisit your design brief. Maybe you'll want to discuss it with your clients. Perhaps the brief's not wide enough. Do you want to change anything? If you're evaluating products, well, you could use this knowledge to make some choices or to predict take up of the solution. Maybe you need to change something to make it give it wider appeal. So we're hoping that when people use this tool, they'll give us some feedback about it, and we can improve it. Just to summarize then, how could it be used? We think it can be used to develop a brief with gender SMART goals. We think it can be used as a design tool to prompt thinking about intersection needs. We think it could be used by evaluators, buying products, comparing, competing products. Perhaps the local authority could use it as a checklist when they're thinking of purchasing a new solution. So there are different ways it can be used. We've made it available on our Gender Observatory under resources with some instructions and a blank template and some worked examples. So we hope people have a go, use it, incorporate it, perhaps using it for these different purposes. So thank you very much for listening.
Hello, my name is Kat, and I'm going to present factors affecting the mobility of breastfeeding mums in public spaces. So the main area of the study was to explore barriers to mobility and freedoms of mums who would like to breastfeed in the public. We wanted also on this occasion to discuss conceptual designs, existing designs, provide critique and feedback, but also see if there is any gap in infrastructure we can fill with new design provocation. So we used ethnographic interviews to investigate lived experiences. We also analyzed social media analysis. So aims of the study was to primarily identify experiences, attitudes and beliefs towards breastfeeding in the public. We wanted to understand barriers to breastfeeding in built environments, specifically in urban environment and public transportation. And moreover, to identify needs for products and design solutions that would encourage breastfeeding or nurturing parents to nurture babies in the public. But before I will share findings of what we found out in the study, I will give you a brief background. So unfortunately, UK data is not very optimistic when it comes to breastfeeding. We have one of the lowest breastfeeding duration rates amongst Western industrialized countries. Data from UK Infant Feeding Survey shows that after 6 months, only 34% of mothers were breastfeeding, despite quite relatively high levels of rates of mothers who initiated breastfeeding. Over 80%, 81% of mothers started. So it really asks a question, what happened and what kind of barriers they encountered, and what's happened, they stopped. Data shows there is many barriers to breastfeeding, starting with biological one, societal one, cultural and infrastructural. And we wanted to look into infrastructural barriers, especially in urban environment and transportation. As we know, women and mothers are not homogeneous group. There is variation of approaches among mothers. The most marginalized groups have also low level, low rates of breastfeeding duration, and they are, in UK case, young mothers or women coming from lower socioeconomic background. Some academics argue that discourse around breastfeeding, public breastfeeding, is still very problematic, and we have ambiguous attitudes in the public, despite promoting breastfeeding and championing for years and running awareness campaigns and educational campaigns. In fact, and sadly, ambiguous approaches towards public breastfeeding may even stop or prevent women from going out, change their mobility behavior to facilitate breastfeeding, and have debilitating impact on their well-being overall. Methods are used in this particular study was the qualitative mixed method design, and the data was collected last year in July. I had three primary sources of data. One of them was Instagram. We performed the visual analysis of over 100 images. Then I looked into Mumsnet forum and searched it against words like breastfeeding in public. And again, I analyzed over 100 stories. And last but not least, I spoke to mothers about their lived experiences of breastfeeding in the public spaces. Mothers were in majority first-generation migrants and having very recent experiences of breastfeeding in public spaces. I also spoke to practitioners to identify if there is any patterns of struggle or patterns of barriers women are facing in their environment to breastfeed. So the findings from Instagram were quite interesting. What we found out was that breastfeeding was presented as an intense moment of intimacy between mother and child. So all of the captions were revolving around mother and child, with very little acknowledgement or recognition for significant others. So it was all about this relationship, togetherness, and emotional bonding. And here's an extract from one of the posts. There are days where I have enjoyed these special slow moments together, being able to be the only person who can care for Alan in this way, and enjoy those long gazes when he looks up at you. Another finding that emerged from data was that women do not want to leave the space. They do not want to navigate their mobility behavior, so they avoid breastfeeding in the public. They see that breastfeeding can be problematic, and public holds ambiguous attitudes, but we cannot avoid it. And there was a range of different coping mechanisms or coping strategies. One of the most prevalent theme was shielding. So shielding, covering, so staying in the place, but not leaving it, negotiating a space rather than leaving it. As one of the extract explains, yes to taking a dear husband or a friend, it is nice to tuck yourself in a corner and stick someone's large bag between you and the room. Things that gave me confidence were taking someone with me as a human shield. So again, shielding and covering was one of the most prevalent theme as a way of coping with ambiguous attitudes in society. From interviews emerged that acculturation really affects nurturing and mothering practices. I spoke to migrant mothers. All of them have had experiences of breastfeeding in the country of origin, and they all changed their behavior when they arrived to the UK, and this indicates really how quickly they adapted and they assimilated, or they tried to assimilate, to what was for them perceived as dominant culture. It was reflected in Zenaid quote, who is Eritrean refugee and a mother of 5. In our country, it's normal, even in busy places. You have a lot of strangers around and still breastfeed, but in this country, you can't. You need to cover or something like that. You cannot feel relaxed. If you have people around you, they will look and make you feel ashamed. So I always prefer to give him bottle when I'm outside. What's really interesting about this comment was that Zenaid was very certain that this is not appropriate to breastfeed in a public. And what's really sad, actually, is that she is not only missing out on just breastfeeding as physiological procedure or function, she is actually missing out on this deeply bonding emotional moment of intimacy with her son by expressing milk and by avoiding actually breastfeeding in a public. We also asked mothers to reflect on existing designs, and we learned that many of existing designs, they are not inclusive nor attractive, and they always follow what we would call a public toilet aesthetics. They do not protect this intense moment of intimacy between mother and child. And what also emerged from interviews was that designs can stigmatize instead of normalize. And we need to very carefully consider what kind of message we want to send by designing those spaces, because there is responsibility on the designers, because design, through existing in the space, participates in the discourse. So we came up with some new designs which you can access and you can comment on. Feel free to comment on Open Innovation platform. Nicola York designed nursing pot, which can be placed in public places, and it gives you an option to be semi-shielded. It gives you an option to incorporate aromatherapy and music, lighting, and create this unique experience. It allows you also to access it with children or dependents. So the space which can be placed in very busy public areas, but it would not lock you out of the place. It would not completely shield you. It would still make you feel as if you were a part of the space. Through that design, we addressed different barriers. We looked into organizational, infrastructural, we looked into cultural or societal. We also finally looked through intersectional lenses and looked at different demographic groups may different needs and may respond differently to design solutions. In conclusion, the content from social media analysis indicated that the discourse reveals around relationship between mother and child, and there is no mentioning, there is no acknowledgement of significant others, meaning that this is all about relationship, special relationship and bonding between mother and child. Therefore, future design solutions should protect this intense moment of intimacy, and they should be inclusive, they should be attractive, they should normalize breastfeeding, but not stigmatize it. More vulnerable mothers, specifically migrant mothers or migrant from lower socioeconomic background, from specific socioeconomic background, are more likely to feel pressured to shield cover. They are more likely to disappear from public spaces or avoid breastfeeding at all. And of course, variation of approaches. We encounter so many, such a variation of approaches in the data that whatever we will try to design in the future for breastfeeding mothers, we do need to take into consideration different perspective and different accounts and different barriers they may face in built environment.
Hello. This is a quick presentation overview about the DIAMOND project. In particular, we are going to be discussing today the user of rail transport in urban and suburban environment, and how this was used to inform the maturity model that we developed on the back of the data that we collected. So some of you already heard from other presentation, this project is about fairness and inclusiveness for women in the transport sector. And we looked at women in various settings as users, so primarily of maybe public transport in surface public transport, as users of services like autonomous vehicle, so more futuristic scenario, user of bike sharing, and as employee of the transport sector. The presentation of this particular work is about the user of railway and public multimodal transport on the surface. In the project, we started by analyzing what the literature says about the important fairness characteristics as perceived from the point of view of the user. So they were broken down into 3 macro categories related to accessibility of the service, design of the infrastructure, safety and security. And we informed that by not only the literature, but also by running some focus group with end users. We also asked them to complete a dynamic augmented Delphi method survey and to identify particular hierarchy of needs from the point of view of their of the services, and also be able to break that down for particular situation or with user with particular characteristics. So for instance, we found that women traveling independent had more high up in the hierarchy of needs, the way furniture and facility were allowing them to travel or not, comfortably with dependent, and women with low income rate much higher the ticketing option and fares. In doing this work, we also mixed data coming from structured GIS data sources and observation checklists that we run on the actual services. We did that in particular in 3 settings, in 3 case studies. One from a carrier in Spain, one from a carrier in Poland, and then we had another carrier in Ireland we didn't do the full data collection for, but similarly the same methodology was used. So first we identified the total number of stations that they had, and then we the highest and the lowest quantile in terms of territorial, social demographic, and mobility data. So the highest quantile is the one closer to the city center with the highest density of population, etc., and the frequency of services, while the lowest quintile are the opposite to that. Because we wanted to make sure to have an heterogeneous observation sample size. So we didn't actually pick the one in the middle, but we decided to go for the highest and lowest quintile on the basis of this travel index data. And we looked at, we use a checklist that is now available for others to use to audit their services in terms of accessibility of the platform, of carriages, of concourse levels surrounding area, and other characteristics like security and safety. And we complemented this with asking the passengers with a user satisfaction survey that we developed and used. And we were able to get a significant amount of responders in this Irish case study, in the Spanish case, and the Polish one. And you can see in the slide some of the background of the actual sample collected and how they differentiate in terms of different socio-demographic characteristics, ethnicity, and person gender, mainly female and non-binary responders. And then we compared, using the COND, the satisfaction that different users express in relation to different characteristics of the services. So for instance, capability of meeting basic required needs, which means, the need to get to work or to get to destination and do it in a reasonable amount of time with punctuality of services, etc. And we found that, for instance, there are significant differences sometimes with, for instance, between the North and the South and the Eastern European. A negative D means that actually women are more satisfied than men for certain type of characteristics. So, for instance, in the Northern European sample that we collected, the ticketing and timetable that we can on the smart devices was a characteristic that for women was higher rated in general than it was for men. Similarly, we collected, for instance, comfort. Comfort is the opposite. Comfort are for women in the Eastern European sample, women were less satisfied than men with that particular characteristics. Or in terms of accessibility, getting to destination by walking in the Northern European sample, we found that females were more satisfied with that aspect than the counterpart male responders. In terms of safety, we consistently found that females were somewhat less satisfied with those safety and security characteristics than the male, and that was true in the three samples. So, for instance, when arriving or leaving the station, I feel safe at any time of the day. Female felt less safe in that situation. Plus, it's interesting to look at other demographic characteristics like people with chronic illnesses. For instance, in the Eastern European sample, we found that responders with chronic illness were less satisfied with the accessibility of the station, and the services of the station. People traveling with dependent, we found significant differences in the Northern European sample across several statements within the three themes of capability and meeting needs, accessibility, and safety and security. And the same was true for the Spanish in the Eastern European sample. So in the Eastern European, people traveling with dependent and living with dependent were less satisfied across a number of statements regarding, for instance, information, the value for money, and the design of the facilities. And what is probably not surprising, but strikingly so, was the fact that people that experience discrimination on public transport were less satisfied across nearly all statements. So the effect of having experienced dissatisfaction profoundly impact the level of satisfaction with the public service provision that people tend to experience. Also, when there are aspects, there are technical aspects of the services, that experience determine a lot of the satisfaction or lack of thereof that people experience. We were also able to distinguish and benchmark the samples across the locations to find that, for instance, the Southern European seems to be more satisfied across a number of categories, except the ticketing and the economic value of the travel experience. And when we compare male versus female and non-binary, we found the non-binary on a lower level of satisfaction than others. We also, as you can see, this is the curve across all the categories of The blue curve is the one with people that did not experience discrimination, and the orange one is the people that experience discrimination. And as I said, there are a number of categories, especially related to safety and security, where there is a significant lower level of satisfaction being reported. And people with illness or no illness, again, these are the number of categories that we spoke about, where the difference was reported and was detected to be significant. So in feeling safe and safe of belonging, and capacity for getting help in evacuation, comfort with space, and accessibility of the station are among the main ones. We were also able to do a correlation matrix analysis in the different categories considered for the satisfaction of the service. And we found that there were some clusters that confirmed our assumptions that we can have this three macro area of capability to meet the basic required need, and accessibility and safety and security. So you can see signs, travel information, announcement, etc. are tend to be clustered together, and then operational hours, frequency of services clustered together, and then CCTV, evacuation, feeling safe, the safety of belonging are clustered together. So they tend to confirm that they can be grouped together. We looked at effects of demographic characteristics on significant differences in travel satisfaction, and we found that environment, being from an urban or suburban area, has a significant impact. And sometimes counterintuitively, it's not necessarily true that people from suburban area are less satisfied. In some cases, yes, but for instance, in the Irish sample, we found that people from rural area were in general quite satisfied with the level of provision, which was not exactly aligned with what we expected. Education, the more educated the responders were, the less satisfied they seemed to be. And ethnicity, and this is probably related with other aspects. Ethnicity, unfortunately, people that are out group seems to be less satisfied with the level of services. We also run stepwise linear regression analysis to identify characteristics that are very significant in determining and predicting the level of satisfaction. And we found that obviously easy to get the destination, frequency of service, operational hour, and information provision, real-time information provision, like announcement, were significant factors, as well as walking from the station to destination, value for money, and the environment, which means rural, suburban, and the caring responsibility. So the fact of people with caring responsibility had this factor added difference in the prediction of satisfaction. We also followed up this quantitative data collection and analysis with qualitative interviews and thematic analysis to identify whether there were some themes, so exploring emerging themes. And we did it in the three areas, so for the Spanish use case, for the Polish use case, and for the Irish use case, using focus group or individual interview. Some of those interviews were collected during the pandemic, therefore focus group were not an option. And distinguish between different demographic characteristics and different age group to be able to capture different point of view. And the thematic analysis confirmed the main three overarching themes and confirmed some of those characteristics, but also were able to point out some differences, significant difference in emerging themes that were found to be worth considering, like noise control, sense of place, food options, the fact of having a food option as part of and the social image of using public transport, how it's perceived. Surveillance and emergency alert system were also considered an important theme in the satisfaction of the users. And then we distinguish between barriers and needs. So the barriers are the characteristics that are perceived to be a problem, and the needs are the one that are emerging as something that has to be satisfied and stay pointed out in the three areas. And we also were able to point some similarity and differences across the three European case studies that we were able to directly approach. Like for instance, in the Eastern European sample, we found that they asked for better communication, but that wasn't necessarily asked for in the Irish sample or the Spanish one. similarity were, for instance, different type of ticketing options and different type of value for money option in terms of the process offered for the services. What we did was considering all those themes and aggregating the relevant ones to distill a self-assessment checklist that companies can approach on the web using a toolkit for fairness assessment that we developed to establish a benchmarking across their level of fairness and inclusivity. And we based this on a, let's say, fairness maturity model that has the ranges across 4 levels, from emerging into managing, inclusive, and in a stage of continuous improvement, which means an excellent situation. And depending on the average rating considered across the characteristics that we found to be relevant from, the summary of all the analysis we collected, we are now able to offer these services as a benchmarking exercise that can highlight area of improvement for service providers and can be easily performed and accessed based on the information we have. Not only that, we also developed a Bayesian networks model that brought together all these data sets to identify how, for instance, changing demographic characteristics can impact the forecasting of the travel satisfaction. So if instead of taking a generic user, if we take a user with certain characteristics like caring responsibility, being a female in a certain age group, what is the likelihood of them being satisfied with travel provision as it is now? If we mix that with a good level or a bad level of real-time information provision, how that affect the final prediction? Or if we consider a good level or a bad level of security and sense of place situation, how does that affect the final forecasting? So as you can see, we also tested the model and we found in terms of the area under the curve, a value that the model was a good fit and provided a good representation for the 3 sample data set that were used and collected to inform it. It's available on this website and it's a demo version and can be used for testing. In theory, we can use future data set can be collected and the model can be changed or updated on the basis of the new data set to be collected. So we hope that this information could be evaluated, could be used in the future to help other organizations to consider those aspects in their service provision and benchmark themselves and evaluate themselves against them. Thank you for your attention.